Hi, so this time I'm doing Paulo's case. Um, my diagnosis for Paulo is pretty different from the rest of my group, but since this is an individual video, I think I'll stick to my diagnosis because I think that's the closest we can get to what he's struggling with. Um, and so I want to give the best treatment that I think is going to work. So for him, I went through um, stroke, amyotrophic lateral sclerosis, also known as ASL, and myasthenia gravis. And I settled with myasthenia gravis or MG. For him, I want to talk him through my thought process as well because I think it's very important that a patient knows what's going on if he's willing to listen. Um, I want to let him know that he's done, I think, a good job at taking care of his body, considering he doesn't drink that much, and he doesn't smoke, and that MG in this context is actually an elderly onset version. And so he might have had genes for this disease for a long while, and it is an autoimmune disease. So I'll explain like in general how it works. It's just an autoimmune disease is when your body attacks itself, and this one in particular, he's experiencing muscle tensions and he's not able to use the muscles in his face as um, specifically as he used to be able to. And I want to focus on the fact that these symptoms are what makes it MG and not something else. It's very specific. And the way he's struggling with talking and eating is something called dysphonia, which just means that you're struggling with using your facial muscles. So it's hard to talk properly and it's hard to swallow anything. And it's caused by this neurotransmitter or um, the lack thereof or the inability to process a neurotransmitter called acetylcholine, and that's the main issue here. And so I would want to run him through some tests to make sure that it is in fact MG that we're dealing with. And since MG is triggered by malfunction in acetylcholine receptors, um, I would personally put him on an acetylcholine receptor antibody testing, and 95% of patients with the disease test, or sorry, 85% test positive. And so we're going to do that. And if he tests negative, we don't want to just give it up just yet. I would also want to do an hydrophonium test to see if acetylcholine is the cause of the muscle weakness. And I also want to explain that the muscle weakness isn't the muscles themselves. He's still pretty strong as a person. It's just that the neural impulse isn't passing through properly, so that he's not able to control these muscles as well as he originally used to be able to. I also want to let him know that it is a chronic illness, and so he will have to deal with it, but there are treatments to take care of it, and there are some ways to even reverse some of the problems. And I think symptomatic treatment like acetylcholine sterase inhibition will work really well and will increase the amount of acetylcholine in his body that's usable because acetylcholine sterase breaks it down, and we want to block that. I wouldn't recommend the other treatments because they seem to have adverse effects or they're short acting or it's surgery, and so I think this is the best for him. um yeah, and I think I would tell him to stay strong with it and that it's something we can definitely deal with. It's good that we know that that's what we're dealing with, so yeah.